Action.
Good afternoon. So this is Dave Walmsley, and we are going to talk today about the use of PPE at Emerge. First, what PPE do you need if you are working with someone on an everyday basis? Well, if you want to use gloves, then you'll need gloves. If you aren't going to use gloves, then you need to wash your hands, and that will be the first thing that you will do. You'll then use a mask. So I will wash my hands. I will be using alcohol here because I don't have soap and water available. Soap and water for 20 seconds, or alcohol that you rub in until it is completely dry. I then want to put my gloves on, holding at the wrist, okay, to make sure that I'm getting them on properly, okay? And the reason I'm going to do this is I want to make sure that my hands are clean before I put them up around my face, because what we're always trying to do is to make sure that we are not getting any kind of droplets or anything in our face. After that, I will now use a surgical mask. I'm going to check the mask and make sure I know which part of the mask has the metal bar in it, which I can't see. That's always the top. So I'll now take the mask. I'm going to put it on past my ears. The next thing that I want to do is to pull the mask down, and then I want to take 2 fingers. I want to put them on the metal strip and push it back so that it fits my nose. Your mask must be over your nose and over your mouth, because that's how you're protecting from any kind of an intake. To test, blow out. See if you have all kinds of air blowing out at the top. If you do, go back and readjust your mask. Now we're ready to go. I'll use this mask anytime that I'm around people. That's a requirement that you use that, because we want to keep you safe and we want to keep everyone else safe. When I'm done with the PPE, I will first be taking my gloves off, because if my gloves touched other things, then they're now contaminated. I can take my gloves off in a way that doesn't touch the surface. I'm going to grasp on the wrist of the first glove. I'm going to pull it off inside out. I will then take my hand and put inside the second glove so that I've never touched the outside of the glove. I will push it down. The gloves are done. I will then take my mask and I will remove it. Please remember that we are asking that everyone have 1, 2, 3 masks, and that you rotate every day and let your mask dry for 2 days before you go to the next mask. Now, what if you're working with someone where there might be an exposure and there's higher risk? Well, in this case, we're going to use additional PPE. So the first thing that we're going to do is to use a gown. So I'm going to take the gown, I'm going to put it on first, okay, and I'm going to put it over my hands. And once again, I would have washed my hands before I started. Depending on the kind of gown, I would either tie it at the top or I would tie it in the front. This is a gown that would have been tied in the front, but we're just going to keep moving along. After I put my gowns on, then I want to put on my gloves. So I will take my gloves, I will put them on, and after I have put the gloves on, I want to be sure that they are over the wrist of the gown so that I have protected my entire hand. So I get my gloves on, okay? I make sure that the gloves are over the wrist of my hand. Okay? My next step will be to put on my mask. And if I'm around a place that is at risk, it will be an N95 mask. So in order to do this, I'm going to grasp at the mask. I'm going to put it over my face, okay? And I'm going to have, if this one has 2 different things, so I have to take it back off, okay, and put it on. And I am going to move it down, okay? First, I'm going to put the lower strap below my ears. I'm going to put the upper strap above my ears. I'm now going to form fit this to my face. So I'm going to put the mask on, and just like with the surgical mask, I'm going to take my fingers and I'm going to press in. I want to pull it down over my chin because I've got to cover both my nose and my mouth so that I'm safe. Now I'll blow out. Make sure I don't feel air coming out. If I do, I'll readjust. Okay. and then I can suck in to make sure that it comes in just a little bit. Okay. Once it is on, I'll now put my face shield on, and you can use goggles or face shield, and I will put it on over. When I am ready to take everything off, I will take it off in reverse order, but this is the order that I will take it off in. These hands are now contaminated, so I want to take the gloves off before I touch anything around the face area. So once again, I'll take my gloved hand, I will touch only the wrist, I will take that off, I'll put my finger underneath the glove so I'm touching the inside, and I will pull the other glove off. Now I have my hands that were covered. If I have any concerns, I will wash them with soap or alcohol before I put my hands around my face. Once I am done with that, I will now be able to take off my gown, and I will only touch the inside of the gown so that it will have time to dry before, and so that if it is soiled, not soiled, we can reuse it. Once I have that off, I will take off my face shield, and now the last step will be to take off my mask. Okay. And I will set that mask aside so that it can be reused. So that's all there is. That's what we want. But by me using PPE, it helps keep my face area safe so that I don't give someone anything and they don't give it to me, because as we all know, with coronavirus, COVID-19, you can give it to someone else and be positive without having symptoms. So please be careful. Keep everybody safe.